Hello there. My name is Tasha Heaton. I'm an industrial hygiene consultant with the WisCon program at the Wisconsin State Laboratory of Hygiene. In this segment, I'll be discussing heat stress and heat-related illnesses. What is heat stress? The OSHA Technical Manual defines heat stress as the net heat load to which a worker is exposed, whereas heat strain is the body's physiological response to heat stress, like sweating. Heat-related illness can affect workers in many industries at indoor or outdoor work sites. Some job-related risk factors include outdoor work in warm weather, heat sources such as ovens, fires, or hot tar, strenuous physical activity, and heavy or non-breathable work clothes and PPE. Illnesses that can result from excessive heat include heat stroke, heat exhaustion, heat cramps, heat syncope, heat rash, and rhabdomyolysis. I'll talk a little bit about each of these next. I thought it would also be a good idea to mention sunburn here. Although not all heat exposures are from outside work, a lot are. And when it's hot outside, the sun is typically shining down. And as your typical redhead, the sun is not my friend. The most serious heat-related illness is heat stroke, which occurs when the body becomes unable to control its temperature. Heat stroke can cause death or permanent disability if emergency treatment is not given. Symptoms of heat stroke include confusion, loss of consciousness, hot, dry skin, very high body temperature, and rapid heart rate. Following that, we've got heat exhaustion, which is the body's response to an excessive loss of water and salt, usually through excessive sweating. Symptoms of heat exhaustion include headache, nausea, dizziness, weakness, irritability, thirst, heavy sweating, elevated body temperature, fast heart rate, and decreased urine output. Up next, we have heat cramps. These usually affect workers who sweat a lot during strenuous activity. The sweating depletes salt and moisture levels in the body. Painful cramps can result from low salt levels in muscles. Symptoms of heat cramps include muscle cramps, pain, or spasms in the abdomen, arms, or legs. As a note, heat cramps can also be a symptom of heat exhaustion. Moving over to heat syncope. Heat syncope is a fainting episode or dizziness that can occur from prolonged standing or suddenly rising from a sitting position or lying position. Dehydration and lack of acclimatization are factors that can contribute to heat syncope. Symptoms include fainting for a short duration, dizziness, or lightheadedness. Continuing on, we have heat rash. This is a skin irritation caused by excessive sweating during hot, humid weather. Symptoms of heat rash include clusters of red bumps or small blisters on the skin that often appear on the neck, upper chest, groin, under the breast, and in elbow creases. Then, last on our list, we have rhabdomyolysis. Rhabdomyolysis is the medical condition associated with heat stress and prolonged physical exertion that results in the rapid breakdown, rupture, and death of muscle. When the muscle tissue dies, electrolytes and large proteins are released into the bloodstream, which can lead to irregular heart rhythms and seizures and kidney damage. Symptoms of rhabdomyolysis include muscle pain, dark, meaning tea or Coke-colored urine, reduced urine output, weakness, or exercise intolerance. A person with rhabdomyolysis may also be asymptomatic. Employers and workers should become familiar with symptoms of heat-related illness. When any of these symptoms are present, you should promptly provide first aid and not try to diagnose which illness is occurring, as diagnosis is often difficult because symptoms of multiple heat-related illnesses can occur together. First aid for heat-related illness involves the following principles: taking the affected worker to a cooler area, such as the shade or air conditioning if you have it, cooling the worker immediately using active cooling techniques such as immersing the worker in cold water or an ice bath. You can create an ice bath by placing all the available ice into a large container with water, which is standard in sports and is thought to be the best method for cooling workers rapidly in an emergency. You could remove the outer layers of clothing, especially if they have heavy PPE on. You could place ice or cold wet towels on the neck, head, trunk, armpits, or groin, or use fans to circulate air around the worker. You should never leave a worker with a heat-related illness alone, as the illness can rapidly become worse. so stay with the worker. And always, when in doubt, call 911. Nearing the end here, I would like to mention the OSHA NIOSH Heat Safety Tool application. It can be used as a resource for planning outdoor work activities. The app features a visual indicator of the current heat index and associated risk levels specific to your current geographical location, precautionary recommendations specific to heat index associated risks, an interactive hourly forecast to help plan outdoor work activities in advance, editable location, temperature, and humidity factors for calculating variable conditions, and signs, symptoms, and first aid information on heat-related illnesses. Some recent reviews within this year say that the app has good graphics, is very informative, and is a great tool for fieldwork. It's available on both Google's Play Store and the Apple App Store. In conclusion, this has been a brief overview about heat stress and related illnesses. OSHA, NIOSH, the CDC, the National Weather Service, and other organizations provide great resources on this topic, some of which are shown on screen.